Good evening to everybody. My name is Kumba Kamara. I am here to explain my goals as a nurse. What am I gonna be doing for a patient and care I'm gonna deliver to my patients. And as a nurse, what am I supposed to do to put in place to address patient needs? First, to start with, my name is Kumba Kamara. I'm from Sierra Leone. I'm married. I have 2 kids. I have a daughter. Her name is Nina Kamara. I am here to explain my goals as a nurse. As a nurse, I will do the following things. I will implement the following goals while giving care to my patient. I will implement good communication, collaboration, which is working as a team. I will advocate for my patient. I will use evidence-based practice to deliver my care for my patients. I want to address those things one after the other. When I talk about culturally competent care, first of all, we all in the United States of America, we came from different countries. We came to this nation, and we have different people from different countries with different cultures. As a nurse, when you're working with those type of population, you need to, first of all, assess the culture of a patient. When you're assessing the culture of a patient, you don't have to be judgmental. You have to be non-judgmental, because these are very important issues that will make you deliver an effective patient care. First of all, if I want to approach a patient, I will first of all knock and introduce myself and ask my patient the preference, what name do you want me to call you? Secondly, I will ask them what is their culture? Knowing the culture of a patient is very important as a nurse. That will help you to give a patient-centered care. Talking about a patient-centered care, a care that you give to a patient that you got to involve the patient. You involve the patient 100%, that the patient has to be the person that lead the care that you are giving the patient. In many cultures, you have to ask the patient the preference, the person who is the leader in their family that have the right to treatment. Like, for instance, in my culture, the father is the head of the family, and they have the right to every treatment. So you first of all want to know the type of culture the patient is. If the patient need somebody to interpret, if they cannot speak the English, because most of us that coming from another country, English is our second language. Some of us cannot even speak it fluently, so we need an interpreter. As a nurse, I have to involve in an interpreter, like a professional interpreter, that will come in and help me to deliver my care. Secondly, I want to know the name of the patient. I want to ask them, which name do you prefer for me to call? When I do that, that will give the patient confidence, and the patient will believe, oh, I am the leader of this care. Somebody's not going to just come in and tell me what to do. They give me an opportunity for me to explain, or me to lead this care that they are giving to me. Secondly, I want to build a trust. When I give my care, I want to build a trust with that. They call it patient-nurse relationship. How do we do that? Going to the patient, first of all, you have to establish boundaries. Boundaries in the sense, like, you come into the patient, you knock. You tell the patient, for instance, my name is Kumba Kamara. I'm going to be your nurse from 6 o'clock to 2 p.m. And I'm going to be working with you today. So already you have established your boundaries. The patient knows you're going to be working with her or him from 6 a.m. to 2 p.m. So within that range, the patient is expecting you to be taking care of him or her. Secondly, if you want the patient, you want to build a good relationship with the patient. If at all the patient, you tell the patient, I will be back in 10 or 15 minutes to help you, and within that time you show up, the patient will have trust in you. But for instance, if you tell the patient, I'm coming in 15 minutes and you didn't show up maybe after 1 hour, that would be a little bit of this and distrust. The patient would think, oh, she's not saying the truth. Another thing that I'm going to be as a nurse, my goal is to be an advocate for the patient. A nurse advocate, I will always speak on behalf of my patient in terms of treatment. I will stand on their behalf when the patient, because I am the one who is closer to the patient. The patient like to explain their problems and what they need for their care. As a nurse, I will be an advocate between the patient and the nursing team and the doctors and the lawyers, whosoever is part of the care of the patient. I have to stand on behalf of the patient and be an advocate. An example, how can I be an advocate? If the patient said, I'm going to go through this surgery, but I don't want to eat, I don't want to take this medication because this medication is not working for me. And the doctor said, this medication is what you're supposed to do. I will stand on behalf of the patient and tell the doctor that the patient, we have to go by what the patient do. The patient has the right to their care. The patient has the right to refuse and refuse care. That's their right. So we're not going to force a patient to take a care that they are not willing to take. So I will stand on behalf of the patient and talk to the doctor. Why can't we listen to the patient and go this way instead of taking this medication? Why can't we use this other method? Like maybe try the patient of X. Like if the patient doesn't want to take medication for pain, like ibuprofen. The patient said, I don't want to get used to ibuprofen. I will talk to the doctor, why can't we use ice pack, warm packs? Instead of, if the patient is complaining of back pain, the doctor prescribed an ibuprofen. The patient said, I don't need an ibuprofen for my back. Then I would suggest, as a nurse, stand on behalf of the patient, tell the doctor. Then I'll ask the patient, what do you prefer instead of ibuprofen? If the patient said, I prefer taking ice packs, putting them at my back or pillows, I will talk to the doctor. I think we need to use non-pharmacological intervention first and see how it works. Or let's do what the patient wants us to do. She or he does not want to take ibuprofen. They want to use ice pack and pillows to see how their pain level, how to treat their pain. So that's an example for a nurse advocate. You always stand on behalf of the patient, and the patient has the right in their own care. The patient has to run their own care. The patient has to be involved 100%. We're not gonna take the patient out of their care. They have to involve. They have to tell us what they need, and we have to work towards their needs. Another thing another goal that I would focus on as a nurse is evidence-based practice. When we talk about evidence-based practice, we talk about research, current nursing, how the nursing is developing. When looking for information that are current, that are being validated, something that they have been proved, that the healthcare system they have gone through research. Like for instance, if they said if we are talking about UTI, the recent development, the recent research of what will make a patient, what will prevent patients from having UTI. Those are evidence-based practices. Those are research medical doctors, medical organizations are doing every day, trying to see the possibility of how to reduce UTI. Like for instance, if people go to the hospital, they have the hospital acquired diseases, like using bed pumps, using doing catheters. These days we are trying to, the nursing system is trying, the medical system is trying to discourage catheter, like urinary catheters, for them to be used, because when more you use the urinary catheters, the catheters within the patient, it gives them an opportunity. It's like they are exposed to infections. So for us to discourage those things, we need to do research. What we need to do better to discourage or to eliminate or to decrease the use of urinary catheters while patients are in hospital, while they are going through surgeries. What are we as nurses? What is the evidence-based practice? What is the research that is going out there that people are doing, meant to just minimize the way people are giving urinary catheters? Because when you give more patients urinary catheters, possibility for them to have UTI is in a great is a great. So in that line, we need to focus on evidence-based practice. What are we doing now to prevent those things from not happening? Those are the things we need to know. As a nurse, we have to be going continually educating ourselves, doing research, finding out the best possible care, the best safe care, because the whole thing about nursing is giving safe care, safety. We need to be safe for our patient, need to be safe. We need to prevent them from having infections. We need to eliminate things that will cause infection, things that will bring them more to the hospital, things that we have to discourage those things. So as a nurse, you have to start doing research. What is the best possible way I can help my patient from not having infection? Like for instance, I have to wash my hands every day. They said let's use the sanitizers, but washing your hands frequently is more effective than sanitizer. So what am I gonna do? I'm gonna keep washing my hands anytime I give my patient care. If I have a bedpan, I need to sanitize it, wash it. I cannot use that same bedpan for another patient. That's how you give infection from one patient to another. So all those things are we need to do research. We need to read and understand how we can minimize the 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 the, the, the chances for our patient to not having infections. This is one of the major example of evidence-based practice. Again, as a nurse, I would work collaboratively with my co-partners. Collaboration means teamwork. I have to work with my co-workers. Like we have the healthcare team. The healthcare team involved the doctors, the nurses, the therapists, the speech therapists, the physical therapists, the CNAs, the everybody in the team. We have to work as a team. Working as a team makes the job easier, help the patient to have effective care. For instance, like we have a care plan. You create a good care plan. The care plan is a major way to communicate, tell you the process, the how to take care of the patient. This patient needs two people to transfer. This patient cannot take this food. These are all care plans and care plans are individualized. We don't have one care plan for all patients. Each patient has their own care plan. We call this individualized care plans. Each patient has their own care plan. A patient A can transfer himself by pivot, limited assist. Patient B is a total care. So by putting all these care plans together, the team come in and read and know how to start to take care of this patient. The patient like to be addressed in this way. Before you go to the patient room, you have to knock. Secondly, you need to provide privacy for a patient. Thirdly, you need to ask the patient preference. How do you want me to take care of you? These are all in the form of a care plan. You just cannot go to a patient place and start doing care. No, you have to explain what you are trying to do to the patient and ask the patient, how do you want me to help you? Which name do you want me to address you with? What and which time do you want me to come into your room? And how do you want me to, what do you want me to do? Which type of food? You know, all these things and the care plan. The care plan is the thing that helps the team that take care of the patient to do. How do are you sure? Not yet. They go finish the recording sound. Sorry, I got distracted. So care plans are the things we use to take care of our patients. They are the form of communication. Another goal I'm going to be using to take care of my patients is effective communication. They call it therapeutic communication. Therapeutic communication is a way you act, you create. This therapeutic communication is more effective in the mental health status. We talk to the patient very calmly. You listen to them. You allow them to lead the care. Listen to the patient. Be an effective communicator. You listen to the patient. You keep silence. You make an open-ended questions. You don't come and give them yes or no. You allow them to elaborate, to talk what is their needs, how they want you to take care of them. Then you come in and ask them and reinforce and ask them, what do you want me to do for you? How do you want me to help you? Those are the things. You keep them open-ended questions, allowing the patient to talk. You don't ever ask a patient a why question, because a why question is like ending the communication, is like you leading the communication for the patient. But effective communication can prevent accidents. When if you communicate effectively, especially with the team, your co-workers, they know, like for instance, if I come into work in the morning, when I give a report, I have to make sure I communicate and give effective reports to the next shift. So when they come, they know exactly what they are expecting. But if I didn't give effective reports, the next shift comes in and they find out something they can't find, they don't know what to do. It will cause harm to the patient. Effective communication helps to make the patient, make it more effective, prevent safety. It may help you to give safe care. So we need to be an effective communicators. And secondly, therapeutic communication that will bring the patient. You don't have to come and start arguing with the patient. They are already having issues, so you don't bring your issues at work. You need to stand and give them effective communication, therapeutic communication that will give them healing, give them hope. Another thing I would do is like always helping the patient, leading the patient to let them know that I have somebody with me, that we let them have trust. You have to be honest with your care, and you have to be on time, and you have to make sure you give them the care they are expecting you to give. Some of the patients will tell you, I pay to live here. You don't have to argue with them. You make sure they are the leaders of their care. If they want to put on anything, ask them, do you want to put on this today? Yes, this is what I want to put on. How do you want me to iron it? Do you want me to wash it tomorrow morning and keep it for you outside? You just give them that. Let them have let them lead their care. It helps them to dignify them, respect them. They're gonna think, oh, I am still at home. This is how I used to do. So this is all I have for my audience this evening. And I thank you all for listening. And God bless you all again. My name is Kumba Kamara. I love you all. Thank you. Bye.